Hello everyone online who's listening and watching us. We are very happy to welcome you today to our interview, and before I introduce our very special guest, I would like to introduce us. Here with me are Teresa from Taiwan, Lucrezia from Italy, and myself, I'm Tabea, I'm from Germany. And the three of us are interviewing today a very special guest, and we feel very honored today to have you with us, the ITI President, Charlotte Stilwell. Charlotte, you're a specialist in prosthodontics, and we will know more about this later on. And you have worked in private practice over 25 years. And since 2021, you are the president of the ITI, and you're the first female president, which can also be a topic today. So welcome to our interview.
Thank you very much, Tabea, and hello to you, to Teresa and to Lucrezia. I really look forward to our conversation today.
So I'll be the first one to raise the first question to you. So what is your vision as president of the ITI, and how do you think the ITI can reach out to young colleagues and helping them to pursue their goal to become experts in the field of implant dentistry?
Teresa, I think you might even say passionately share the ITI's vision that we all collectively seek to inspire and engage as many of our colleagues around the world as possible, and also across the whole team of the dental profession, to strive for the excellence in that implant therapy that we provide, and then to choose the ITI as the academic partner and the community and network, if you like, that enables you to do so for implant dentistry. Now, if we're looking to our younger colleagues who are setting out on their implant journey, I really think, because it's been so for me, even if I came to it somewhat later in my career, that ITI really has been an absolutely ideal partner, and can I put it this way, professional home as well, for enabling and empowering you to progress from beginner through to, if you are aiming for that, expert. And I think it starts with education. It probably starts with simply feeling comfortable around implants. And then if you want to take it up and be more involved in practice and progress safely in the knowledge that what you do and what you provide is the best evidence-based and patient-centered care that you can have. Because ITI has the education, it has the community, the network around the world and local to you, regionally and around the world, to enable you to progress, both clinically and actually also, for that matter, to advance to become a leader in this field.
Thank you so much, Charlotte. I think as a young professional myself, I really feel like ITI is a really big family to me. And then the most important part is there's so much resources, as you mentioned, and then also evidence-based in implant dentistry. I guess that's one of the things that we should really follow as a young professionals.
My question is, I think, very interesting for us, because we wanted to ask you, as a woman who's been practicing implant dentistry when the field was mostly only male and led by men, we wanted to ask you what challenges you faced along your path. And if you had any challenges or hurdles or struggles, how are you able to overcome those?
I think maybe one of the challenges is that, and I think I'm reasonably typical in this way as a woman dentist, that I quite like to feel really sure that what I'm doing is the right thing and that I do it in the right way. And that is particularly the case, when you embark on something new. So when I really sort of came across implant dentistry in seriously, the first time was in mid-1990s. And really, there just wasn't the kind of educational content that suited my early stages and introduction to implant therapy. And there wasn't any kind of structured training path, because I suppose implant dentistry, if not in its infancy, it was certainly in its very early stages. And I found that particularly difficult. Early experience and memories is that I moved to a specialist practice at that time, and there I met patients who'd already had, at that time, extremely complex implant treatment, not least because that's probably where the need, of course, really was for implants and still is. But we also know that if you're a beginner, it's not the right place to start. And now I was faced not just with these complex patient cases, but also the fact that many of them had very serious complications and failures. And frankly, it was a nightmare. So I was very lucky at the time that there were 3 colleagues. They were all men. A prosthodontist, a surgeon, and a technician. And they were sort of willing, they had the patience to help me. But the real game changer was probably when the surgeon amongst the 3, who was one of the very original group of ITI fellows, introduced me to ITI and encouraged me to get involved as soon as it opened up for general membership in sort of around 2004, 2005. I mean, that really made a difference to me.
Excellent. Thank you so much. So I think definitely it's something that we can relate to when you're starting out and maybe you're a little bit uncertain, you're walking your first steps. It's really, really important to have good mentors, I think. And it sounds as though you definitely had the right learning environment, even though it was a little bit challenging. And I think as many of us have experienced, as many of our female colleagues have experienced, oftentimes our mentors are males. So it's very nice to be able to have that collaboration and have a very nice type of establish a teamwork. Although the ITI is very keen on fostering and supporting female leadership in the field.
Indeed, we are.
Thank you very much.
So I have the shortest question, but maybe the most difficult. I don't know. So what would you consider, maybe in hindsight, but what would you consider to be your greatest professional achievement? Can you tell?
That is an interesting one. I think I was actually, Tabea, I was asked that when we were together in the World Symposium as well. And I always wanted to be a dentist. And I wanted to work in practice. I wanted to work with patients. And I think actually, you kindly said I'd worked for 25 years in practice. It's closer to nearly 40 years now in practice. And actually, I think if I look back, that I'm really proud that for closing in on 40 years, I have done exactly that and remained as keen and as motivated as ever. And perhaps I'm particularly proud of it because I had a difficult start. I trained in Denmark, and in the mid-1980s where I qualified, there were just no jobs for dentists at all. So I had to find my way and somewhere else. So I moved to the UK. And I did find my way in a completely different system, and really without any kind of structured treatment paths, either in prosthodontics for that matter, or in implant therapy, which have only since then become available. And so you might say I sort of learnt on the job. And again, as Lucrezia was saying as well, under the generous guidance of mentors, and that is just so important. But what also became so important to me is that family, that professional family. And I think that was Teresa perhaps mentioned that the ITI is, and where I feel that I've really been able to keep that motivation going and to today feel as keen and as motivated as I ever did. And that is just so important.
Sounds very interesting. And also the thought that maybe an achievement is not that a specific step that you take along your path, but maybe the achievement is to have, or it's an everyday achievement that you like what you do. You like to be a dentist, and everything else, all the steps you take might be achievements or not, but maybe the greatest achievement is to be satisfied and happy with the job every day that you do, and to be happy treating patients.
Keep going over a whole career.
Yeah. Thank you very much.
We were chatting about this before this interview started. So regarding the pandemic, this is one of the challenging ones. What has been the greatest challenge that you faced during the lockdowns? And also, how do you think the pandemic has affected learning and conferences in our field? And do you think those changes are here to stay?
You know, Teresa, I found it very difficult to officially be stood down. I was told today you need not come in. To be told that my role suddenly had changed from chairside to be a dentist who was limited to offering advice, analgesics and antibiotics, and to do that over the phone. I mean, you know, to not be able to help your patients if they've got acute pulpitis, that's really, really tough. And clearly this was not the same in every place. It was not everywhere that dentistry was completely closed down. But what we did all have in common the world over was how on earth are we going to mitigate this disaster, you know, in terms of how we're going to deal with this airborne pathogen. And I think from an ITI perspective, which was my sort of saving grace, because we launched the COVID portal, so that was something to do, where we sourced and appraised and then featured the most relevant scientific information as it emerged. And I think when you talk about what did we learn, well, I think we actually learned, even as an organization in implant dentistry, that it's really important as an academic partner that you address and also curate both emerging trends as well as established evidence. And funnily enough, of course, that was the theme of our World Symposium, but that, you know, that you are not just looking backwards at what's established evidence, but you are also trying to help and be a partner for your members for that the new techniques that come along. You know, how should we relate to that? How should we look at it and critique it, etc. Then, of course, we also learned so much about the blending of formats so that you can deliver education in so many ways, and that will of course also affect conferences going forward, you know, that we can both have online and you can have face-to-face. But I think we have learned, Teresa, that both have their important place. We cannot give up on face-to-face. People are desperate to get back together again.
Thank you so much, Charlotte. I think face-to-face is so important, and then we see you on so often still traveling. So I'm sure that people are very happy to see you in person. And then, of course, as you mentioned, I think the online platform is another way of learning that it's very new to us, but we're start getting used to it. And also, it is very important that ITI giving the dentists some guidance, and then to have them to follow, and then to face this challenge during this pandemic. So thank you so much for doing all of this.
Yes, I have another interesting question, Charlotte. It's about basically looking back on your career. So what advice would you give to a younger colleague? And on that note, what advice would you give to your younger self? You mentioned you had some challenges. You mentioned you had to change countries after your training. So it does sound like you did face some challenges, and we would love to hear a little bit more about this.
I think that dentistry is a vocation. I mean, we work with people. It's a high-touch type profession, and it can be enormously rewarding to contribute to the well-being and health of your patients, but it can be very tough too, can't it? It's not an easy job to have. So I think it's really, really important that you find ways to continue to feel inspired and motivated. And I think really ongoing education is probably the absolute key to this, because it's through that you discover, that you move with things, that you see what might now interest me. And so I suppose that's where it comes in. If I had my time again, what would I do? And because of my sort of changing country, and also to begin with having to work in a university, in a hospital, and that was absolutely wonderful for me, because that's why eventually I became a specialist in postodontics. Nonetheless, because I wanted to be a practicing dentist, I think I missed this thing that I was really there at the coalface and got and working and practicing dentistry in the way that I would have got the global measure, if you like, of the job. So I think if I started again, I would go out there and I'd go into practice, and I'd really get on top of feeling comfortable with dentistry in general, you know, almost to the point where whatever comes through the door, I know I can deal with emergencies, etc. And I think that's the best possible basis then for choosing where you're going to go with this next. And I chose postodontics because it kind of wraps them all up, doesn't it? It's the you deliver the final end product. You're there at the beginning of planning it, and you're there at the end. And actually, to me, implant dentistry is rather clever in the same way. It seems a very sound choice, because like prosthodontics, it links all the different disciplines together. You will have to be fairly on top and up to date on everything, really, in all surgery, in periodontology, in restorative dentistry, to combine all of that knowledge so that you can apply it to implant therapy. And of course, sometimes it isn't going to be implant therapy for the patient. So once the patients are in front of you, you have to know the rest of dentistry and be able to offer that as well.
Thank you. That's really an excellent answer. So basically, you underscored the importance of being prepared, the importance of continuing education, keeping motivated throughout your career. Of course, the importance of being able to face pretty much any challenge. So not just being prepared in a very, very minor specialty of implant dentistry, but kind of, I guess, having a comprehensive vision, which is important because it makes us feel much more secure and confident that we can actually cater to our patients' needs 100%. So that's a very, very nice answer. Thank you very much. At this point, this was the last question of our interview series. So we all want to thank you. It was a huge pleasure to have you here for our virtual interview. It was definitely very, very enjoyable for all three of us. I know I'm speaking for Tabea and Teresa as well. I hope the audience also enjoyed it. What I wanted to say is that this is just the first of a very nice lecture series, interview series, and we would love for you to keep following us, so stay tuned for more. Thank you very much.
Thank you very much. Thank you very much.
So may I say also that there's no doubt that what you're doing, Young ITI, is actually very good for all of us. Your energy, your drive, your ideas bode really well, not just for ITI, but actually also for implant dentistry in general. So thank you very much for having me. I have loved it. And I'm looking forward to your many, many exciting projects that I know are planned for 2022 and beyond.
Yes, thank you so much.
Thank you.
Thank you so much.